Okay, well, wonderful. Well, thank you for having us. Well, welcome everyone to the talk on the road to independence, tools for a successful transition to adult care. My name is Adam Greenberg. I am a nurse practitioner at the Children's Hospital of Philadelphia and co-director for the adult care and transition team that focuses obviously on transition of young adults to adult care. And I will turn it over to my colleagues to introduce themselves.
Hey, hi, I'm Natalie Stollon. I'm a social worker at the Children's Hospital of Philadelphia as well, and also part of the adult care and transition team. Nice to be here with everyone today. And Simi?
Hi there, I'm Simi Trachtenberg. I'm the other social worker with the adult care and transition team, and I'm really excited to be taking our program on the road and having you join us. Go ahead, Adam.
All right. Well, thank you again. Yeah, we're looking forward to talking to everyone. You know, we have slides that we want to go through, obviously, but we'll keep this informal as well. So please, if you have questions, please put them in the chat function. So we're here to talk about healthcare transition. So what is that? I'm sure you've heard of it before, but the definition that we look at is the purposeful planned movement of adolescents and young adults with chronic physical and medical conditions from child-centered care to adult-oriented healthcare systems. And, you know, along with medical transition, that's one of a lot of transitions that young adults will go through. You know, there's high school to either work or college, there's moving out, or even going into relationships. So this is just one piece of a larger movement of young adults. Obviously, in terms of medical care, it's going from patient-directed from parent-directed to self-directed. And we also, you know, want to acknowledge too that for parents, this is a transition as well. Particularly, you know, they're going from what we would say is probably the primary care provider to a consultant. So it's a transition for parents as well. Obviously, our young adults are going from dependence to independence. And really, when we think about the why of transition, it's really because it's the right thing to do, right? We want to promote, from a developmental standpoint, independence, and also age-appropriate care. Our young adults are now adults. They have adult bodies, and so therefore, it should be adult providers that are taking care of them. And finally, what I just want to say about healthcare transition is, you know, we talk about this a lot with our family consultants and our family advisors here at Children's Hospital of Philadelphia. And they said it's really important that we normalize this transition, right? That we mark it as a healthy rite of passage for our young adults. So we're here to talk about that and provide a general roadmap of the process. So how does it work? So what I'm kind of focus my talk around, at least a part of my talk around, is approaching this process using kind of a guideline from GOT Transition. And GOT Transition, in the States at least, is the federally funded resource for on healthcare transition. And they say there are 6 major ways that we need to think about transition in a time-wise approach. One is, what are the guidelines for transition? How does CHOP track it? In other words, what do we do to make sure that we are moving patients along the process? What can patients, young adults patients do, and what can parents do to help this? At the point of transfer, which is when we're actually thinking about moving to adult care, what we need to do, what to expect at that first adult visit, and then what to do after we transfer care. So for the next couple minutes, I'm going to be just breaking down each one of those elements of transition. So the guidelines, one of the questions we hear very often is, when am I going to transition? Or sorry, when is my young adult son or daughter going to transition? And the true answer is it's going to vary, right? Even within a hospital, it might depend, you know, it might be provider department specific. And it could be different for each person too, because there are factors that could impact the timing of it, right? If a patient is medically stable, they might transition a little bit sooner than a patient that's not. If a patient's going away to college, you know, a provider might say, I'll hold on to you until you go to college. The 2 important things to remember is that GOT Transition really just recommends starting those conversations early, even as soon as 12, just to say, when do you think I'm going to transfer care, right? And then secondly, just talk to your endocrinologist about the best timing for the transition for your son or daughter. Right, and that's really a discussion and agreement that you can have. For those here that might be from Children's Hospital of Philadelphia, Our transition age, we expect to transfer patients by age 21, but again, some providers might start as early as 18, which happens in primary care. So why it's important to have that discussion. So tracking transition. And so, why I bring this up, not so much so that you know exactly how your pediatric endocrinologist tracks transition across time, but really just so that from from 12 to 18 that you're having different discussions. At 12 maybe you're talking about transition time, when it's going to happen. Maybe at 14 you are seeing the patient or you're seeing the provider alone. At 16 or 17 you're going to talk about legal changes that happen at 18. And really the point of this tracking is just to make sure that when it's time to transfer, it's not a surprise. So at at the visit at 18-year-old, you're not hearing from your provider that this is going to be your last visit, and we've missed, potentially 6 years of doing all of the activities that could get you ready to transition, really to provide that anticipatory guidance. I'm going to share these slides, but really on the bottom, and I'm going to continue to reference them, God Transition has a really good resource of, putting timestamps on when different discussions and activities should happen. So when we think about actually preparing for transition, and again, not the transfer, but just preparing those years before transition, how can you get yourself ready? And it really is a multimodal approach in the sense that everyone plays a part. Your pediatric endocrinologist can help you prepare for this. And that could be setting goals for knowledge, which is, the basics, knowing the names and doses of your medication, and encourage you to take more responsibility for your care. That could be something like tracking symptoms. For you, for the young adult, if you're on the line here, really this time from 12 to 18 is a time for you to speak up and talk to your provider alone and start to think about the questions you want to ask them and the conversations you want to have about, what care might look like after 18. I think the most important thing that you can take away in terms of really preparing is knowing when to activate your emergency plan and what to do, right? That's really the foundation for patients that have, pituitary disorders, right? Is knowing, when you get sick, what you're supposed to do. And for the parents and caregivers out there, this really becomes an opportunity for you to encourage your son or daughter to take more responsibility for their care. And that could be one, calling to make appointments. They could be on the phone with you. Same thing with refills. And really to just see how they can be, how you can kind of share this work so that they become more comfortable having those conversations. It can be really awkward for young adults to start to talk to docs. We want to help them find their voice. So when you're thinking how to plan for transition, things do change. Once you see adult providers, there are very specific changes at 18 that we can go into in a minute. But one of them is really, when you see adult providers, you are in charge of your own healthcare. So you go into that visit, that provider is going to be talking to you and is going to be asking you questions and expects you to have some, really good understanding of your own medical care. It can also be helpful to discuss your healthcare with family members that have made those decisions for you in the past to give you some insight onto what they think is important that you think about for your care as well. And again, this kind of reiterates what I said before. The medical team is going to be looking you to schedule appointments and so forth. And then finally, and Natalie's going to go into this a little bit more, it's important that you think about where you're going to be after you transition to adult care, because you have to make sure that you know the medical providers that are in that area. One of the concrete things that you can do as you prepare to see adult providers is get your medical records together. Obviously, your pediatrician can assist you in that, and they can make something what's called a medical summary for you, which is really kind of a summary of your care to date, the active issues, and how you manage them. In your phone, there is a section, you can update the health section of your phone with active medications and conditions in case of an event, and also update your in case of emergency person so that there is someone to contact in the event of an emergency. And so really here, this is just kind of just briefly showing you what on your phone, how you can update it there. Again, we can share these slides with you so that if you have an iPhone, you can click that link to figure out how you can make those changes. And then same thing if you have an Android phone. So when you actually get to the time of transfer, right? So this is when you're 18, 19, 20, whatever, and your pediatric endocrinologist says to you, I think it's time. I think that your next visit might be your last, and we have to think about adult providers. One of the things that is important to talk to them about is where you should be seeking your adult care, right? And really what I mean by that is that, for some conditions, a local endocrinologist might be fine if your disease is stable. Perhaps if your disease is more complex, they might want to send you to a specialty center. And obviously those things depend on availability and proximity of providers and insurance. So again, it's important that you have that very specific discussion with your provider. Who should I go to? And knowing the factors again are what's in your area and what insurances might be available. For the young adults, when you think about what you need to do, and again, this is after you've really this is kind of the concrete stuff to bring with you. Make sure that your medical records get to your adult provider. I know that may sound kind of obvious, but doesn't always happen seamlessly. So some systems, computers may talk to each other, others may not. So it's making sure that you have a copy of your medical records. And part of that actually might be calling the adult center first to see exactly what they need. And again, the other considerations when you're thinking about transfer is where you're going to be, right? And how that's going to impact where you're going to get care. What I kind of talked about a few minutes ago was, that there are some healthcare changes at 18. And again, this is at least in the States here, 18 is the legal definition of adulthood. And what that means is that you are now the medical decision maker. So that if you had to have a procedure or if you had to have anything done in the hospital, they're going to look to you to sign those documents. Doesn't mean that you can't have people supporting you in those decisions. It just means that ultimately your name is on the dotted line, so to speak. And that actually also has to do with your medical records too. Once you turn 18, you have control over who can see your medical records. Again, you can have your parents or your partners, look at those medical records too, but it all has to go through you. One of the other points that we just like to bring up, because you just might hear this term once you become an adult. I already talked about medical decision making and you're calling the shots and sharing your medical information, but it's something called advanced directives. Again, this typically happens if you were to get admitted to a hospital and it'll say you're over 18, do you have an advanced directive? And really what that's asking is that if you can't make a medical decision for yourself, and perhaps if you're in crisis or really sick, you couldn't, do you have a document that says who should be making those medical decisions or who can assist in making those medical decisions if you can't make them yourself? And typically, if you don't have one, every state, again, at least in the States, has different rules for getting an advanced directive, but you should always feel comfortable asking a social worker or perhaps a case manager that you might work with if they can give you more information about that. So, you've done all the work, you've done your transition preparedness, you've made the appointments, and you're getting really close to that first appointment with the adult provider. Obviously, you want to call and register, make sure that they have your insurance, write down that information, be ready for some differences between pediatric and adult care. I can share a link with you there that kind of just talking very broad strokes about how they're different, but what I think I want you to take away from that is in the pediatric world, we might call you a couple times if we don't hear from you. In the adult clinical world, they don't hear from you, they might not call you back. So it's important that you really are leading your care coordination in adult medicine. Obviously, we want you to practice discussing your medical history. And at the visit, again, make sure your records are with you. Don't forget other documents like your insurance cards. You want to have a copy of that. Come on time. Allow some extra space to find it. And then really don't expect any big changes to happen at your first visit. And, in my conversations with other adult providers, including Dr. Carlip, who is one of the, adult endocrinologists at Penn, which is the medical system next door to CHOP, she said the same thing, that she won't make any medication changes at the first visit. It's really an opportunity to get to know you. And then she's going to focus again on the basic, those sick day rules, self-management strategy to prevent crisis. And then if there are any barriers to care, making sure that she understands those as well. So what happens after you transfer your care to adult care? So a couple things, right? So you may not just be seeing one specialist, you might be seeing maybe in addition to an endocrinologist, you could be seeing a PCP, you might be seeing a cardiologist. So that other care is going to transition as well. So know again that this is a process. And I also say continue to get to know your adult providers. Why do I say that? You've had a relationship with your pediatric endocrinologist maybe for upwards of 21 years. And so when you see someone new, it's going to feel a little bit different, right? The expectation is high. Obviously, they should know, your medical history and your medications, but it might take some time to get to know them, right? They want to provide you with good care. They want to get to know you, and you want to get to know them. So really the takeaway is to give it time to develop that relationship with adult providers, and obviously continue to build on the skills that you need to manage your own care. Obviously you can let your other pediatricians know about your transition, and your pediatric office may reach out to you as well. I think kind of at least where I want to end my session really here is just talking about really, how to stay healthy after you transfer, right? Like how to live your best life. We know that with young adults, particularly with hypopituitarism and with other pediatric onset diseases, that mortality during the 20s or late teens and early 20s is highest of all decades. And many times the reason isn't so much the disease itself, but our priority shift, and maybe we become a little less compliant with taking medications, and maybe a little less compliant with going to visits. And we kind of get that, right? Because there are a lot of things going on in your life that you want to be paying attention to besides your illness, right? Like school, work, relationships, new experiences, and that's as it should be, right? So if we can kind of boil it down to really the most important things we want you to remember as you start to see adult providers is that having a supply of and taking your safety medications when needed, right? So that goes back to the point I made a couple slides ago to say you really need to know what your sick days are, the symptoms from your sick days, and then what the plan is for your sick days, right? So if you have adrenal insufficiency, you want to think about making sure you have your hydrocortisone shot, and obviously for diabetes insipidus, that you have your desmopressin. And along with that, you should think about designating a person, your person, and it could be anybody, that's why I have it in quotes, that should really be providing you your emergency medications if you can. Parent, partner, trusted friends. And we also want you to have ongoing discussions with both your pediatric and adult providers on very specific things, so that you can arm yourself with the right information. One of them is reproductive health. That's important to think about, for patients to know if you at some point do become sexually active, and you're thinking about contraception for young women. Are there medicines that are contraception you should be taking or not? And really, of course, to pregnancy. With certain chronic diseases, pregnancy can, have higher risks associated with it. So it's important that you're having that conversation. Secondly, again, we know that you're young adults and that you're going to be, with friends that are drinking and maybe even doing drugs. And it's important you have a conversation with your providers about the impact on your body of those things. I didn't include smoking on there because I absolutely don't want anybody smoking. And then finally, just routine vaccinations. Again, this is kind of the boring stuff, but we still want you to get your flu shot every year if you're going away to college, those appropriate vaccinations, really to limit any of the stresses on your body that could potentially put you in a crisis. So again, a lot of information. At the end of it, there are plenty of links to GOT transition and the different steps along the way. But I hope really that just gives you kind of a broad framework for how we approach transition, and the important things is for you to know and for your parents to know as we move towards transitioning to adult care. And with that, I'm going to turn it over to Natalie. Thanks.
Oh, you got it. You got some applause there, Adam.
Right.
Thank you, Adam. Very nice.
Oh, sure. Thank you.
Okay, so we'll just move along, and there will be time for questions at the end. We do have some opportunity for that, but if you think of things and you want to put them in the chat, feel free. We're also a relatively small group, so we're going to try and be interactive. If you're all up for that, we can use the chat or just unmute, because even on a good day when I get to present in person, I get bored of listening to myself talk. So I'd love to hear you all, all of your thoughts. And we have here, so Adam talked a lot about healthcare and kind of what that can look like to move from one healthcare provider to the next. But I really love that he kind of ended on, could we put those links in the chat or where we can get your slides? I believe the conference will be sending out the slides at the end to everyone who attended, and someone who is from the conference can clarify that. But what I was saying is really the goal of this is to live your best life, right? And we talk a lot about healthcare, but the goal of staying healthy is really so that you can meet all the goals and do all the things that you want to do in the future, right? Like work, school, relationships, all that good stuff, in a young adult life. So we often use this tool. It's called the Transition Readiness Assessment Questionnaire, the TRAC. And you may have seen it before. There is one there's like an endocrine specific one, which is at our links in the end, which you will all receive. But this one's just more general, but we think it applies to any type of chronic condition. So looking at things like managing medications. Do you fill a prescription? Do you know what happens, what to do if you have a bad reaction? Things like appointment keeping, things like that, and tracking health issues, managing daily activities, even if it may not seem healthcare related. Do you help plan or prepare food? But sometimes, especially, it can be related to healthcare, right? You need to know what kind of foods are healthy for you to eat, what kind of foods could get in the way of your health condition. So really, really learning all of those things. And we don't put this up to be overwhelming. I know we probably have some parents and some youth who are here with us today, but these are just some things to start your thinking, and to really have these conversations, and to not try and pick all 20 at once, but to try and pick them, take one and then work on that and celebrate the things that you already know how to do. I bet there's at least one thing on here that you already know how to do. So let's move to the next slide, Adam. And so you may have heard this before, SMART goals, right? But just a reminder. So thinking about goals that are specific, measurable, achievable, realistic, and time bound. And that's the reason why I bring this up, is because I think when we do look at the track, or we think about becoming adults and moving to adult healthcare, it can be overwhelming, right? All the information that you need to learn, all the things that you need to learn how to do, or know where they are, or all that information. And so really thinking about breaking it down and taking it one step at a time, and saying, okay, and then over the next 6 months, I'm going to learn how to reorder my prescriptions. So it's time bound. I think that 6 months could work. I have to reorder them every 3 months. So that gives me time to do it twice. What's that going to look like? How am I going to know that I did it, right? That you can, maybe that's looking like you did it all by yourself without your parents' help. So lots of different ways that we could think this through. And if you're a parent or guardian on the line, helping your young adult think this through as well. And also, we know sometimes it can be hard to give that up. And to really, but what is the plan that you can set out together so that you move from being sort of in that driver's seat to being in that passenger seat. And maybe you have, when we take driving lessons, maybe you have that emergency brake if you need it, but you really are letting your young adult, start with driving at least, step by step. So we'll move to the next slide, Adam. Okay, so some examples, and I think we talked about some of these, right? Learning more about healthcare, right? I think a lot of times many folks are very lucky to have parents and caregivers who know about their health condition, and some health conditions can be quite confusing, but learning what we need to know, and that's why we encourage folks to start talking to their doctors alone, even at a younger age, 12, 13, 14, not for the whole visit, but for part of the visit. So you get to ask those questions and you get them to be, you get the explanation that you need, right? And you also might want to talk to your parents, right? If they know about your health condition, you can have those conversations to really help you understand and practice explaining it to someone else, right? That's how we really know that we know something, if we can explain it to someone else really clearly. And so that's something that we sometimes talk about with young adults, is like, what's that 2-sentence explanation of your health condition that you need to tell your friend or your roommate if you have one in the future? Things like that. And then we have the taking on more of your healthcare, and that's kind of what we just talked about when we look at the track. So those prescriptions, those appointments, that health information, do you know where it is, right? Like Adam said, and I know sometimes there are lots of medications and long names and stuff, and so no one expects you to memorize everything, but just have it in a place that's easy to get to, right? If your phone is the place, then keep it in your phone. If you like paper and you like a little list in your wallet, then do that. There's lots of options, but making sure that you have that information if you need it. And then speaking up for yourself, and depending who you are, this can be more challenging, right? But thinking about speaking up in a doctor's appointment, so asking your own questions that you may have, or speaking up. Some of us have, if you have opportunities at school or at work, if you need an accommodation because of your health. So maybe you need some extra breaks, and you could request that and talk to your boss about that if you have a part-time job. So these are some ways to start with practicing these skills, because it does take practice. Next slide. So what are some things that you should know? So I think So and these are some things that we talk about. And again, it's not that you have to know these off by heart. You just have to have them somewhere that you can get to them, because you might have to tell someone this when parents or caregivers are not around. And then the other thing is, in case of an emergency where you were not able to provide this information, is it somewhere easily accessible? Someone's saying that they don't see the slides, although I think that's more a technical issue. I'm sorry, Lisa, that you don't see the slides. I'm trying to talk through most of them, so hopefully you'll get all the information and we'll send these out later. But if any of my conference colleagues are able to assist Lisa, that would be wonderful. Okay, so where can I start? Keeping a folder with important papers. And I know we don't all like to keep folders or papers nowadays. I don't love to either, because they end up in a pile on my coffee table. Some people are more organized than me. But if you're more into technology, you might want to scan the important papers and keep them somewhere safe, in your phone, on your computer, in a file, whatever works for you. But really thinking about where do we keep our medical information so that you have it? And especially when you're thinking about transferring to an adult doctor, where you might end up needing to share some information with your new adult doctor that they don't have, or that that could be helpful to them. Again, practicing explaining your diagnosis. First, you can practice with maybe a family member who knows it already, but you know, and they can give you that, you know, information. And also maybe then practicing with a friend who doesn't really know what your diagnosis is, and seeing if they can understand the basics. And then we know that there's maybe folks on from all different countries, but just if you do have an insurance card and you having that information, sometimes we recommend that parents or guardians request an additional card so that you each could have one, just so that everyone has that information if they need it. Next slide, Adam. Okay, and then taking care of yourself. So we talked about filling your prescriptions, remembering to take medications, keeping those symptom lists, and really thinking about, you know, what are your own health goals, and talking about that with your doctor. And I know we have only a few minutes, no, 15 minutes left, so we want to save some time for questions. So we'll move to the next slide a little more quickly. Again, speaking up for yourself, one of them, you know, I know that we don't all use the phone as often as, especially teens and young adults are not always as used to making phone calls, but still for some things we do need to make phone calls. But thinking about what do you need to make a phone call, and if you're more comfortable with an app, you can, you know, you can reorder a lot of prescriptions on a pharmacy app. Sometimes you can schedule appointments on an app, things like that. So if you are more comfortable with that technology and with fewer phone calls, then learning where you can utilize that, but also practicing those phone calls, because unfortunately for the time being we'll still need to continue to do that. Here, Adam, if you could just, and we can go to the next slide, because I think I talked through that. So again, planning for your future, and this is really the most fun part, right? So what do you want to do after you graduate from high school? Are you thinking about work or college or vocational school? Lots of different options, and really thinking about how do you choose an option for your future where you can still stay healthy. And if you have an IEP, an individualized education program, then speaking up at those meetings and really talking about how can you get the help of your teachers and your other folks at school to really help you work towards what your goals are. If you don't have that, then just talking with school counselors, healthcare providers about what you think you might want to do, and are there any accommodations that you might need in order to do that? Are there any things that are really important in a job? You know, this may not apply to you, but for some folks with chronic conditions, they can't stand for a long period of time, or they might need to be able to take a break where they can sit for a few minutes. So things like that are reasonable accommodations that you should think about as you're choosing your job, and then you can also talk to your employer or supervisor about that. Next slide. Okay, and then these are just some resources, and we kind of talked through, you know, what many of them are. We talk about if you are planning to go to college, just getting registered with the Office of Disability Services, even if you don't necessarily have any learning needs or identify as someone who has a disability. That is, you're just letting them know that you have a chronic condition, and you know that you could end up with, you know, getting sick. Hopefully that doesn't happen, but at least it's documented ahead of time. So if you needed to miss something, you know, you could just let your professor know, hey, we are, you know, they already know this. This is already documented prior. And I'm gonna stop there for questions. I know I have a question about a release of information for parents or guardians. So maybe I'll start with that one. And that's really kind of up to you. So someone had asked, do you recommend considering signing a release of information for parents or previous guardians so they can step in to discuss care if needed? I would say it's a family decision. Many of our young adults do that. They say, yeah, sure. My parents are, you can definitely know about my care, or, learn, be there to answer questions. And so they do sign that. For some folks, they may be less comfortable with that. So I think it can be a really helpful tool. And I don't know if Simi, you wanted to add anything else about that, because I know you do some work on that.
Sure. So what you might want to think about is just at what age, when people turn 18, that's really in the United States, that's really when people have the opportunity to decide who can have their information. And so that's one thing that you need to be thinking about. The other thing is that guardianship is very restrictive. So many families and many kiddos decide that that's really not for them. On the other hand, if it's somebody who really requires somebody making all their decisions for them because they really are not capable, guardianship would be the way to go. And if you were to do that, or power attorney, I would suggest that you speak with an attorney who's had a lot of experience in that area.
Okay, great. And if there are other thoughts or questions, we can put them in the chat, and then